please visit our website to view. It should be up by the beginning of next week. October 27th is the Monday of next week. Should be up by then. And as always, please help us out. We want to make sure we're improving our programs as we go. So complete the post-webinar survey. Tell us more about how we can improve. All right, we're going to get started very shortly. Before we do, just a quick introduction of our two panelists. Jasmine N. Hall Ratliff is a program officer at Robert Wood Johnson Foundation. Her work to create a culture of health across the country includes reducing childhood obesity through policy change and advocacy and connecting community development with health outcomes. Amanda Maria Navarro is Deputy Director at PolicyLink. She's currently overseeing efforts of the National Convergence Partnership. She provides strategic guidance, technical assistance, and training to public and private agencies and organizations on strategies for creating healthy, equitable communities. I'm going to toss it over to Amanda and Jasmine shortly. Before I do, we'd like to learn a little bit about what you all know about the Convergence Partnership. So if you can help us out, please respond to the poll. It should be showing up on your computer momentarily. We'll give you about 15 to 20 seconds. Tell us if you've heard of it. If you haven't, we have a couple of more polls coming up shortly. So keep a lookout for those as well. Looks like most of you have voted. I'll give you about 5 to 10 more seconds, and then we will close the poll. Okie doke. I'm going to close the poll and share the results. It looks like 80% of you have not heard of the Convergence Partnership. Very interesting. Should be very interesting for our two panelists and may color the conversation a bit. But hopefully you'll leave the webinar knowing a whole lot more about that. So without further ado, I'm going to toss it over to Amanda.
Thank you, Michael, so much. Can you hear me?
We can hear you. You should have the option to share your screen momentarily.
Okay. Okay, great. Well, hello everyone, and thank you so much for joining us today. I am really excited to be joined by Jasmine in sharing with you the Convergence Partnership and our efforts at the national and regional and local level, and to be able to talk with you afterward about what does it mean to really bring philanthropy into a very different model by which we converge efforts and converge investments in a way that will have a much deeper impact, particularly on communities that have been left behind. So I wanted to just start out with a little bit of an overview of what the Convergence Partnership is, where our focus has been over the last 7 years, where we're planning to go in the next 3 years, and then I'll turn it over to Jasmine to talk specifically about the role of the Robert Wood Johnson Foundation as part of the Convergence Partnership and some learning along the way. So the Convergence Partnership is a collaborative of 8 major foundations and healthcare institutions, along with the CDC, and the Centers for Disease Control serves as our technical advisor, all engaged in multi-field, equity-focused policy efforts to achieve our big vision of healthy people and healthy places. As you can see here, this is our steering committee. Our newest member of the committee is the Rockefeller Foundation, so we're really excited about that. And PolicyLink, which is the organization that I'm part of, is the program director. And for those of you that are not familiar with PolicyLink, PolicyLink is a national research and action institute that focuses on racial and economic equity by lifting up what works. So all of our work is really looking to local leaders and seeing local leaders as our national leaders on how we really need to advance an equity agenda in our communities that will bring benefits to low-income people and people of color. And Prevention Institute, also a nonprofit organization that's spearheading efforts around prevention and health systems and equity, serves as the strategic advisor for the partnership. So as I mentioned, the vision of the Convergence Partnership is healthy people, healthy places, a nation in which every community fosters health, prosperity, and well-being for all. So our mission is then threefold. In order to achieve our vision, we are focusing very intentionally on three elements. One is equity, to ensure that everyone has the opportunity to participate and prosper. Two, we're focused explicitly on changing policies and institutional practices as a way to remove barriers and create conditions that sustain healthy people and healthy places. And the third is to build bridges across different fields and sectors and break down those silos that we have traditionally been working in to really bring forth much more integrated and holistic efforts that will have community-wide impact. The three changes that we actually want to see in communities, and this is actually something that came out of our strategic planning process that we launched at the end of 2013, which I'll talk about in a little bit. There's three key outcomes that we're looking for. One is to improve access to quality services and systems, and this ranges from transportation, healthy food, parks and recreation, and other infrastructure and investments in communities that allowed all to thrive. The second, as I had mentioned, is equity, that not only lifts up community assets and creates economic opportunities for low-income people and people of color. And the third is that we're actually bringing forth the leadership representative of these communities that have been left behind to really shape and contribute to the solutions at the local, state, and federal level. So what we see over the past 7 years has really been the difference in the type of work and the type of impacts that we've seen from a convergence model has been, we have never left focus on equity. Equity has been at the forefront of all of our work. It has been the rationale and the driver by which the partnerships makes its decisions, both in how it engages in various activities and how it makes an investment. So who does the funding go to, what is it for, and how best will it ensure that it will have equity impacts. The second is this idea of collaboration and really redefining the boundaries of philanthropy. And this goes beyond just information sharing. The Convergence Partnership developed an MOU that lays out very clearly the type of shared leadership and decision-making model that is so central to our work. We have a pooled fund where each individual institution must, in order to be a member, must put forth $250,000 or more to the pool fund. And that pooled investment is then decided upon as a steering committee collectively on where those resources should go. And what types of grants are made over time. The second is this idea around strategic opportunism, and that's really sort of an adaptive asset-based analysis that we use to assess the benefit of our joint investments and activities. And we apply this analysis to every strategy. And so the key question that the partnership consistently asks itself is, what is the added value of the partnership? And many times we will assess that there might either be, it's a crowded field, there are already leaders in the space that are moving forth some very important work. We would not add something that might fill a gap or add some sort of unique contribution. And at that moment, I think the partnership would then says, well, let the others take this on and we'll see where it goes and can provide support if best. But again, the really central question to answer is, what's the added value that we have if we enter any space? And then fourth is, along with building this national presence and working at the national level, we've realized that healthy people, healthy places, the vision cannot be advanced if we don't help to support the work at the local and the regional level. So we've built a network of about 80+ foundations across the country that all in some way are leading convergence efforts locally and regionally, and I'll talk about a little bit more about that in a minute. So over the past 7 years, we have worked on a variety of issues. One has been very focused on transportation. This was actually the very first issue that the Convergence Partnership took on back in 2007. And at that time, the partners were asking themselves, well, what is an area of work that no one institution around the table is working on, but collectively we can share the risk and work on together? And the partners then came to the area around transportation and how transportation connects to health and equity. So as a result of that, they provided funding support to 3 national organizations to advocate for policy change on the federal transportation reauthorization. That included American Public Health Association, the Leadership Conference for Civil and Human Rights, and T4A, which is a broad tent transportation coalition. Now, most recently, we've actually been doing some work at the state level, which is supporting equity advocates in California around legislation SB 375 that's really looking to push climate change legislation that will have impacts as well on transportation and health. The other big bucket of work has been access to healthy food, and predominantly that has been around supporting the development of the Healthy Food Financing Initiative. And for those of you who may not know, that actually was modeled after the Pennsylvania Fresh Food Financing Initiative, which was a loan financing program to incentivize the development of grocery stores, other retail, farmers markets, gardens, urban farms, conversion of corner stores, all to, again, increase access to healthy food in low-income communities and communities of color. That national program now sits at the Departments of Agriculture, Treasury, and HHS, and we're now supporting a network of grantees across the country and really learning some really important lessons around the how to best leverage and bring together investments in a way that will bring equitable impacts to access to healthy food. Now, as you see under the federal policy advocacy piece, and as you've heard me just say, the partnership has not only invested in advocacy, it has also engaged in advocacy directly. And it has done this in a number of ways. It has submitted memos to federal agencies like HUD around the Sustainable Communities Initiative. It has also released public statements, also sent letters to Senate subcommittees on very important issues that are related to the convergence efforts. So the partnership understands that it's in order to really shape and influence policy, it both needs to invest in advocacy and in organizations that can advance those advocacy efforts, but also ensuring that they have in and of themselves a voice on what types of policy changes are made and how best they can make them that will have equity impacts. And then lastly, we've been doing a lot of work around field building, as I said, really seeding this movement locally and regionally. We currently have 14 regional convergence partnerships across the country, and those partnerships all look very different, and I'll show you a map. I can show you that map right now. This is where we're currently located. The green identifies the 14 regional convergence partnerships that are across the country, and again, these are predominantly funder-focused partnerships that have also broadened their partnerships to advocates and practitioners and researchers to really build a collective policy agenda that advances the vision of healthy people, healthy places. The dots along the way you'll see across the country are Innovation Fund. And Innovation Fund is a 3-year matching grant program that provides local foundations funding support to then support community projects that are either looking at the food system or looking to improve the built environment. And we currently have 28 of those Innovation Fund grants currently in place. So before I, so why don't we move on to actually the blueprint.
Well, Amanda, Amanda, I'm sorry, let me hop on. We have one poll question we just want to jump to, and folks, we'd like to learn a little bit more about what the work your organization is doing. So should see a poll launch momentarily. Want to know which is the highest priority for your organization. So please take just a few seconds to complete that for us. All right, great. Looks like most of you have voted. So we're going to close that poll. Some very interesting results there. It's like community economic development and transportation actually leading the way with 46%, but impact investing, prevention, and health systems not too far behind. Thanks everyone for participating.
Wonderful. That is really exciting to hear. Well, so let me just switch focus a little bit to just share about our strategic planning process and sort of where we're going in the next 3 years. And I'm going to talk through our blueprint for change. And when we began this process of exploring, well, what does our next 3-year strategic plan look like, we started out with doing a scan of fields and engaging the national partners in a series of conversations. And predominantly really looking at, well, what has our assessments told us? What has this network of 80 foundations told us and really informed us about what really needs to happen? And what do we know since 2007 when the partnership formally came together? And what do we need to build on to continue to have impact on our vision of healthy people, healthy places? So we did quite a bit of soul searching to define what we saw as the convergence difference, and also really looking to what do we want to put forth in the coming years. And so here you'll see the elements of our strategic plan. And I'm going to go through these very briefly. And just to first outline that the priority outcomes for the next 3 years are the ones that you see here. Specifically, they're looking to continue to improve policies that advance healthy and equitable communities, also to look at how there might be increased investments for people and places that need it the most, to increase the voices that bring forth policy changes that are equitable across the 5 focus areas, as well to see changes in practice, and I would say here probably more specifically around philanthropic practice. How does philanthropy change the way it does its work, the way it does its grant making in a way that really embraces and promotes our vision and mission around healthy and equitable communities? Also looking to continue to expand our network of convergence champions and deepen their capacity and elevate their voice that will have a much bigger voice to policy change at the state and federal level, and continuing to increase collaboration and decrease these silos across fields and sectors. And then lastly, to bring greater awareness and understanding of convergence, which we're hoping to do today. So I'd mentioned some of the core strategies that we've been involved in over the past 7 years, and we've further refined these for the next 3. As I said, advocacy is central to the work of the partnership, both in investing in advocacy and also in having a voice directly in shaping policy. The other is, of course, investments, making joint investments that will generate and also leverage resources specifically for low-income communities and communities of color, to continue to expand and deepen our partnerships in ways that may be different, to bring on partners that we have not traditionally worked with before, to continue to network, build our network of engaged and bold leaders, philanthropic leaders. And then our 2 cross-cutting functions are communications and strategic assessment, knowing that the importance of communication is not only sharing what the Convergence Partnership is, but really providing and shifting the narrative, the national narrative around equity, around the importance of healthy people, healthy places, and what types of policies and investments need to be made in order to make sure that's happening. And of course, lifting up stories where we're seeing success and promise. And then lastly, the strategic assessment is, of course, we have, the partnership has been deliberate in shying away from using the word evaluation and much more turning to this idea of strategic assessment, really looking at what the continuing information that needs to be fed back into the partnership to really assess the impact and the added value of convergence, so that it's not a traditional 1-year-long evaluation after the fact, but really providing a feedback loop so that information that we're learning and the impact that we're seeing or not seeing is fed back to the partnership to make adjustments if needed. As we've already discussed, we've now couple notes here to make. Community economic development is actually now taking over what we had originally termed built environment and transportation. And the reason why is because we realized that, you know, we wanted to broaden this idea around the importance of physical infrastructure, of how communities are designed and revitalized, that will really ensure that there are equity impacts and that development that is created in communities, particularly divested communities, that it leads when ensuring that, of course, if it leads to gentrification, to really mitigate the negative effects of that and to ensure that there is not displacement. So the partners have already started having a conversation around, well, in this space of community economic development, how can we ensure that there's development without displacement? How can we make sure that it is equitable development and that those that are in those communities will actually benefit from the revitalization efforts in communities? And I would love to hear from those that have said that they're really looking at and leading efforts around community economic development on how you're looking at this issue. And the second is food systems, and that is, again, an expansion of where we initially started around access to healthy food, recognizing that that was really just a focus on retail and one link in the food chain. So now we've really expanded it to look at all links of the food chain, distribution, growth, production, as a way to really ensure that there are both food that is being produced for all communities, and also that low-income people and people of color are actually part of the food system in a way that they serve as innovators, as entrepreneurs, as growers, etc. And then the impact investing is actually an interesting space to be in. Where we came into this space was really around our work to healthy food and transportation, and in particular in the access to healthy food arena, where we saw the kinds of investments coming out of the Healthy Food Financing Initiative, both private and public investments that had really broad impact in communities. We thought, well, is there a way to really inform or push or advocate in the field of impact investing for a greater focus on equity? And that's where we're seeing that there might be the greatest contribution to make as a partnership. I've already shared our work around communications and strategic assessment as cross-cutting functions. So I will stop there and turn it over to Jasmine to share a little bit about the partnership, the Robert Wood Johnson Foundation, and its contribution in New Jersey.
Quickly, sorry to interrupt again, Jasmine. I just keep jumping in the middle. But before we jump to you, we want to launch just one more poll, folks, and find out, now that we learned a little bit about what your organization does, find out about how your organization is working with other foundations. So quickly, just respond to that poll for us. We want to learn how your institution has worked with other foundations in your area. It should be open for a bit of time. Looks like we're getting some really interesting responses. We're going to close the poll in just a few seconds. All right, great, folks. So we can see the results. It looks like kind of a mix between information sharing, coordinated funding, and collaborative pool funding. So very interesting for our speakers. And I promise no more interruptions from me, Jasmine. I am going to toss it to you.
I just realized I was muted. Okay.
Oh,
so thank you to Michael and Amanda for having me this afternoon. And as Amanda mentioned, I am going to talk about RWJF's involvement with Convergence Partnership and how we've benefited from this work, and then a little bit about what we learned while developing a statewide partnership in New Jersey. So first out, our work with the Convergence Partnership, if we can go to the next slide, we were one of the original funders and founders of the Convergence Partnership. And we announced in 2007 a $500 million commitment to reverse the childhood obesity epidemic. And around the same time, the Convergence Partnership launched. And during the development of the partnership, at the same time that we were developing our childhood obesity strategy, we saw the appeal and the benefit of working with other major funders. As you saw in Amanda's slides, we have both a mix of national and statewide foundations as a way of leveraging our work to address policy change as a way of childhood obesity prevention. We had relationships, or were able to develop relationships with Kaiser, Kellogg, and the California Endowment in one of our early initiatives related to this childhood obesity prevention work, in which we engaged them to help us find 50 communities to fund under our Healthy Kids, Healthy Communities initiative. It was one of our flagship programs that was launched soon after the announcement, and because California Endowment had been doing similar work in building healthy communities in California, Kellogg was doing work nationally, mainly on the food access side, but still it was community-based. And Kaiser was also doing work, again, predominantly in California, but it gave us an avenue to work with these funders to find communities that were already beginning to change policies and do really forward-thinking advocacy work to create opportunities and environments where children could thrive. So that relationship through the Convergence Partnership helped us jump really right in to finding what was going on in communities and then engaging those communities as part of our funding program. They also were part of an early advisory board, not only to recommend potential advocates, but also, or applicants, but to also speak about those communities where they had experience. Also, with the development of the regional partnerships, we were able to find up to 25 geographically distinct and dispersed regions across the country through the regional partnership work, and encourage communication and linkages between these involved communities and regions. So again, leveraging the work that we were doing under childhood obesity prevention and helping regional grantees and funders further understand advocacy work and equity and policy change, develop the resources for virtual networking, and provide mentoring and communication strategies. These partners, of course, didn't all have to be working on childhood obesity prevention, but they were all working on creating healthy communities. So we saw the regional partnership work as a way, again, of spreading the use and the activities around using policy and advocacy as a way of creating environmental change. The ultimate goal, of course, being that there is a roster of funders that are engaged at multiple levels, from very local or regional up to state, and even in some instances national through the larger Convergence Partnership, and then bringing new partners in these regional collaborations to work on healthy eating and active living that will help reverse not only the country's obesity epidemic, but will also move forward healthy and equitable communities in the long run. And so on the next slide, I want to speak a little bit about more on the program officer professional level, and quoting my former team director, Dwayne Proctor. He couldn't have said it better. It made him, and it makes me also, a better grant maker, because the colleagues that we have around the table at the Convergence Partnership creates a cachet of experts in housing, food access, and healthcare that I can call upon to help me with program development, finding consultants, finding potential applicants, bouncing ideas off of, and of course learning also what they're doing and taking what I learn from what they do and applying it into my own work. Even if their work is not directly related to childhood obesity, it's still around healthy communities. It is helping my new work on bridging community development and health, and learning from those that are around the larger Convergence Partnership table, and even when we pull together our grantees on the regional level, learning from what they're doing locally and regionally that can help further the work that I'm doing at the national level. A few extra benefits. Again, we're better together. We are working in a collaborative and coordinated way, not only through pooling funds, but also learning from each other's work. And a few examples I put up here to demonstrate how the partnership has helped the foundation and the foundation's role in various things that the partnership has done. First off, the Partnership for a Healthier America, which was formed soon after the First Lady's Let's Move initiative as a way of bringing non-traditional players into committing to create healthier communities. And the partnership has been able to engage restaurant chains, hotel chains, child care providers on a national level, supermarket providers across the country to commit to building healthier communities, both where they are locally and also on a national level. And the Foundation, RWJF, and the California Endowment were the original funders due to our complementary work on healthy communities. When Let's Move was launched, there became requests on how can we get involved in Let's Move from an institutional level? How can we work with these foundations? How can we work with the First Lady's initiative? And so the endowment and folks here at RWJF said, maybe there should be some sort of tangible branch of Let's Move that people can work with, commit to certain changes, and be accountable for those changes. And as a result of us working together and working through how this could be formed as a nonprofit, we were able to be the original funders of the partnership. We continue to fund the partnership together. And the partnership is beginning to progress in finding other funders, but they've been really instrumental in bringing in the business side and the corporate side and committing to healthier communities. Some of the policy pieces were not always a direct fit with RWJF's goals in childhood obesity, but our involvement in the partnership's work on these bills helped us further our goals. An example of that was the school nutrition reauthorization. This actually was a direct target in that the reauthorization changed the nutrition policies in the foods that are served and sold in schools for the first time in 30 years. We were funding some projects directly related to advocating for this work, but we also worked with Kellogg and the California Endowment to co-fund a nonprofit that also had a lobbying arm. So as those of us who are foundations who could not fund lobbying, we funded a nonprofit to do some of the research and the advocacy work around it that furthered the lobbying dollars that they received from other organizations to work towards bringing about the school nutrition reauthorization. So again, these sort of, we call them, and it sounds very silly, but we go with these words anyway, twosies and threesies of the foundations working together sort of in a branched off way that allows us to connect some of our really closely held common efforts together into new initiatives that benefit from Convergence Partnership but may be a little bit separate. The Farm Bill is another example where the work of the Farm Bill and the things that the Farm Bill funds and supports may not be a direct target in the Foundation's work on childhood obesity, but it definitely benefits the work and leverages the work that we're doing. So even though we don't work directly in the arena of food stamps and agriculture, CP's funding, the Convergence Partnership's funding of a collaborative effort between FRAC, the Food Resource and Action Council, Sustainable Ag, and the Prevention Institute led to success in the bill that will impact our work, like the Healthy Food Financing Initiative becoming part of the Farm Bill, farmers market incentives and grants to farmers for growing more fruits and vegetables, while not directly addressing the work that we do and the types of policy targets that the Foundation has set out to address. It still will absolutely benefit our work. The transportation reauthorization is again another example where we don't work directly on transportation, but our grantees do, and with our involvement in the partnership, we were able to support creating connections among social justice, environment, and public health advocates in order to develop a more integrated approach in the discussion about the federal transportation bill. And of course, active living, being able to walk to buses and subways are an essential part of a healthy community that would also benefit childhood obesity reduction. And then lastly, again, as I mentioned earlier, regional partnerships have helped us learn what local and regional foundations are doing to address policy and environmental change that will further the work that we're doing on the national level. The investments the Convergence Partnership has made in the regional Convergence grants has leveraged more than $600,000 in matching grants from regional partners and $3.3 million in federal funding. So again, working in a coordinated and collaborative type of way moves work forward much more in a much more impactful way than the foundation could do on its own. So now I'm going to switch a little bit to the New Jersey work. With the New Jersey Convergence, we wanted to try to replicate in the state of New Jersey not only the successful model that was happening on the national level, but other regional models that were happening in other parts of the country. At the time that we started thinking about creating a New Jersey Convergence, the foundation has a particular commitment to New Jersey, and as part of that, under the childhood obesity work, we had a program called the New Jersey Partnership for Healthy Kids, which was working in 5 cities across the state to address policy and environmental change as a childhood obesity prevention strategy. In coordination with that, the state of New Jersey Health Department had a statewide initiative that mainly engaged non-foundation nonprofits around creating healthy communities across the state of New Jersey, again using policy change and environmental change. So we felt that a complementary effort should be done to engage funders on the very same work that the state had already had going on in creating healthier communities. And we'd had a relationship with an organization called the Council of New Jersey Grantmakers that's sort of like the New Jersey Council on Foundations. And through that relationship that we had with them, we gave a grant to them to facilitate meetings and phone calls with a small group of funders in hopes that this could become almost like a steering committee or a core group of partners that would start the Convergence Partnership and then hopefully expand out to engage additional funders and potentially state government. This was an 11-month grant that ultimately did not result in a regional convergence, but we absolutely did learn a few things along the way, and Amanda was very integrally involved in this work through her experience on the National Convergence Partnership and helping form regional convergences. So among the pros in the work that we were able to do in that 11-month time period, we were able to bring together a mix of funders, community, private, and corporate foundations whose focus areas ranged from healthy communities and aging and economic development. So we mimicked the larger partnership in that aspect, in that we were trying to bridge across the silos of foundations within the state. We also, because we were working with the Council of New Jersey Grantmakers, many of the participating funders who we asked to be part of this core group already had some familiarity with each other, because there was an affinity group within the council called Healthy and Thriving Communities that would meet on a monthly to quarterly basis for information sharing and learning from each other. So we kind of had this core group already of funders that were doing this work. They had familiarity with each other, and we figured a good natural next step would be to engage them in this work that hopefully would lead to more coordinated and collaborative work. There were a few barriers, though, that we came across. Most of the foundations that were around the table did not fund advocacy, and they just weren't sure how to approach their bosses or their boards to make this change in the type of funding that they do. And it was difficult for them because many of the people around the table were program staff, maybe a vice president or a program director, but we didn't have the CEOs around the table. And so I think it was difficult for them to try to think through, well, how would we approach our CEO and how would we approach our board to begin funding policy and advocacy. There was also some level of commitment to equity, but there was still a little bit of a ways to go to get the foundations around the table to fully commit to taking an equitable approach and looking at it through an equity lens at the work that the group would do moving forward. And then I had a second bullet of the presence of RWJF, and you would sit there and think, why would RWJF be a barrier? Well, what we learned during this process is that even though we tried to model it primarily after the Michigan Convergence, where Kellogg and Kresge, who are large national players but also have very strong footholds in the state of Michigan, but we found that there were some key differences that made Michigan successful, but what hindered our efforts. And one of those was the perception that RWJF, as the largest funder, should just fund the partnership and lead the work. And we wanted to be more inclusive, but the fact is that RWJF is the largest foundation in New Jersey, and not by just a few $100,000, but billions of dollars in assets. So we were quite literally the $8 billion pound gorilla in the room. And because we were sensitive to that, we didn't play a very strong role in leading the partnership or taking charge in developing the partnership. And I think as a result, we weren't very directive with the council about leading the process. And in fact, after the effort fizzled out, we learned that there were individuals in the room who did in fact wish that we had just stepped up and led the way. So sort of balancing the fact that we were the largest foundation in the state of New Jersey, we didn't want to just take charge and lead the whole thing, but hopefully make it a little more organic and a little more collaborative in nature. In fact, may have backfired on us when instead others were just waiting for us to just take hold and move forward. There was also a perception and a little bit of a history that the foundation had not played well with other funders in the state of New Jersey, and that was something that my colleague and I, who began the work to try to form a convergence partnership, sort of walked into without knowing. So as we learned that, and we learned that folks just maybe thought it was easier for us to just say, hey, we're going to do this and come on aboard with us, that there were some political things and that were kind of in the way of us moving forward. In the end, we ended up not forming a convergence partnership, and it's sort of the group stepped back and decided to instead, again, be an information sharing group. But we certainly learned a few things, and there were some ways that if we were to do this again, we would probably take a step back and take some different actions. So finally, what have we learned both on the New Jersey and the national level? And we want to go to the next slide. In New Jersey, again, RWJF has such a big presence in the state that we need to figure out how to balance and downplay our so-called bigness and figure out what does that mean. Do we need to make a more concerted effort to not lead the process? Do we need to build upon some current relationships first, one-on-one, and then branch out to other funders that maybe we haven't worked with in the past? I have a relationship with a private health foundation in North Jersey. I know their executive director. Maybe I should have started with talking with her first and bringing others on that way, as opposed to just calling a bunch of foundations at one time and saying, come and meet with us and let's figure this out. And then lastly, even though the partnership did not come to fruition, I was able to connect with staff from other foundations, and we did ultimately work together. As an example, this foundation in North Jersey, Partners for Health, we ended up coordinating funding of healthy communities across the state outside of a formal partnership, but still we still call upon each other to find out what our respective work is in the areas of the state where we focus in on, and then coordinate that funding so that there's learning across each of those communities. And then on the national level, certainly leveraging the work of other national and strong state foundations makes the impact of RWJF go much further. Collaboration of not only funding efforts like the Farm Bill, but also joining our influence on federal efforts during the comment period of regulatory work. So the partnership together has been able to send in comments and then leverage that one letter of comments with our respective work, so that any comments that we send in, that RWJF sends in, complements the work of the Convergence Partnership and maybe even reflects that work. And then lastly, from, again, a professional development, personal standpoint, I have had exposure and been able to meet foundation leaders that, with the exception of maybe EPIP, I may not have had opportunity to meet with before. So I've been in the room with the presidents of Kresge and the California Endowment and been able to talk with them and understand their perspective of philanthropy. So this kind of partnership not only works from an organizational level and being able to leverage our work off of each other, but then on a personal and professional development level, you're meeting folks that you may not have been able to meet in other settings. So with that, I think we have a few minutes for questions, if anyone has any. And Michael, I'll turn it over to you.
Thank you, Jasmine. Really great to hear from both of you. Really interesting to learn more about the work, and especially hear kind of about some of the challenges you might deal with, certainly some of the political challenges it sounded like you encountered with the New Jersey Convergence. So with that said, as Jasmine mentioned, we'd like to open this up to questions. As we mentioned earlier, the entire presentation was recorded, will be made available along with the slides on the EPIP website by early next week. So please keep a lookout for that and check back. And I'm keeping an eye on questions. I haven't seen any come in yet, so I have a few of my own, folks. Please don't be shy. Feel free to kind of type in your questions now. But one of the questions we had here on the EPIP side, and Jasmine, again, you mentioned some of the kind of politics around this. One of the really important questions I'm sure some folks are wondering about: how do you get foundations to put their egos aside to commit to this work together? What does that look like?
So I was not with RWJF when the partnership first got started, but I was able to talk with the folks who were and learn a little bit from what happened. And it really was a lot of meetings and phone calls with the foundation presidents and CEOs to talk through what are going to be sort of the guiding principles of sorts of working together, and understanding that this is very much a collaborative effort and no one foundation will rise above the others in the work that happens. And through those conversations, we actually signed a formal memorandum of understanding so that we can hold that tangible piece of paper up to say this is how we're going to work together. And egos, I mean, clearly the MOU does not say egos need to be set aside, but it does clearly outline the role that, you know, the foundations all have an equal seat at the table with this work. And when the work happens, it is under the rubric of the Convergence Partnership. Now, there are times, such as when I mentioned sending in comments during open comment periods of regulatory work on the national level, that the foundations may not participate because the decision-making process is that everyone has to be on board with that decision. If any one foundation does not agree with a proposed action, then none of the foundations are going to do it. And so at times when these regulatory letters or comment periods have come about, PolicyLink may propose, you know, what do you guys think about doing a letter to the Department of Health about this policy that was just, this bill that was just passed, and now the open comment period is happening, and they'll draft the letter, and all of the foundations, we sit with it and internally digest it and make any comments. But if one foundation says, you know what, we can't do this letter for a particular reason, it doesn't work within our own strategy or what have you, then none of the foundations do it. And maybe the letter goes out under the rubric of the Convergence of PolicyLink and the Prevention Institute. So no one has, it's either all or nothing. And no one can really rise above the others in this work. It is very much an agreed upon, we're going to work on this together.
Mm-hmm. I would just add to that, and Jasmine's absolutely right, that I was also not part of the initial forming of the Convergence Partnership, but can share that in many many stories that were shared along the way about those beginnings is there was a deliberate intent and commitment and dedication by the partners to do the upfront work, and knowing that, as Jasmine said, that it needed to have extra phone calls, extra times to meet in person wherever people were maybe traveling to. Part of why the initial founders were coming together was because they were seeing each other so often at many of the conferences. And so that just really began to raise a question about, well, if we're always seeing each other and we're in the same spaces, well, how can we actually build something meaningful as we work together in this same space? And you know, the MOU, it was definitely a process to build trust, to really deepen the relationships among the foundations, to be very honest and candid about where our foundation stood, But I think the trust building piece was really important because to what Jasmine just shared around then being able to create an MOU, everybody was very clear and very comfortable with the fact that everyone was going to have an equal voice and really a shared leadership model moving forward, that not one foundation would take over. I would say equally so, PolicyLink came on as the program director shortly thereafter. And one learning from the partners was initially there was a consultant that was brought on to facilitate the conversations. And over time, the partners really realized that they needed to have expertise and leadership that was really going to guide the funders in a way that would really build out this collective agenda, and that they really needed not a neutral facilitator, but someone that was really going to come in with some ability to direct and guide the conversation and guide the work. And so the partnership put out an RFP to which PolicyLink responded to, and PolicyLink came in very clear to the partners and saying, you know, we have a point of view, and our point of view is equity. And we do believe that the work of philanthropy and working together to really advance not only health but equity will really bring some much needed, deeper and bigger impacts as a whole. And that we would be able to bring that expertise, would be able to bring that connection to communities and really bring the network that we have around advocacy and equity to the table and to the partnership. And so we have learned along the way that with the 14 regional convergence partnerships, one critical factor early on is to bring on a consultant or an organization that can serve as program support to really serve as the guide, as the director, as the support to move the work forward. Because otherwise, you know, there's so much going on. All of you have so much already on your plate, and you really need someone to help keep moving things forward and not let things drop and sort of wane. So program support early on, and someone that can bring the expertise of policy, advocacy, philanthropy, and equity is critical.
It's really, really interesting to hear. It makes a lot of sense. You know, it's about legwork, kind of at the beginning, building that trust, and then, you know, like you mentioned, Amanda, choosing an organization to kind of lead the way. We have just a couple of minutes left. I haven't seen any questions come in. We had one more here. If you both can speak to this kind of rather quickly, something folks are wondering: how do you report success back to your board and your stakeholders? You know, because obviously with a lot of our organizations, that's we want to make sure that we're filling the board in and making sure they kind of know how we're doing. So I think that's a really interesting question.
Yeah, absolutely. I'll start by saying that PolicyLink develops biannual CEO reports. And because the partners, the steering committee members were very clear in saying, you know, we've got to take something back to our boards and our senior leadership to show that the investment in convergence actually meant something and that we're actually seeing a good return on investment. And so as the program director, we've been developing the CEO reports that look at both outline the policy impacts that we've had at the local, regional, and federal level, look at changes that we've made within philanthropy, and also we have been able to show the CEOs how much was invested as part of the partnership in the pooled fund into a particular strategy, and what was the amount, additional dollars that were leveraged out of that. And Jasmine gave an example of that for our food work. So we've been able to really show not only just the impacts on policy and philanthropy, but also resources and investment-wise to show CEOs that they've actually been able to leverage additional investments made from other partners to really accelerate the work.
And then for me, very quickly, with the CEO report and then my engagement in the steering committee of the partnership and then also on the food committee of the partnership, I'm able to basically take all of that back to both my team, and then if it gets to the board level, which it doesn't always get to the board level, but at least to my team and my senior leadership folks, our vice president and team director, I'm able to provide updates and reports on how the partnership has been doing.
That's great. Thank you both. It looks like we're actually right up at 4 p.m. So I just want to, again, thank everyone for joining us. I think this was a really interesting conversation. Hopefully the 80% of you who weren't familiar with the Convergence Partnership know a little bit more about it now. And again, please complete the post-webinar survey so we can hopefully improve upon what we're doing here with our EPIP webinar program. And I just, again, want to thank Amanda and Jasmine for joining us and sharing some of their knowledge and expertise with the EPIP community.
Thanks, Michael.
Thank you, Michael.
Thank you, folks, and have a great day.
All right. Bye.
Bye-bye.